The following segment is sponsored by Northern Nevada Health System.
We are at the Northern Nevada Health System with Cate Barnett, a registered nurse, talking about postpartum care. And Cate, when you bring a baby home from the hospital, a lot of times the mom needs care, not just the baby. So we're talking about postpartum care here. Why is that so important?
Postpartum care is incredibly important for the mothers in our community. When you go home, you're very tired, you're sleep deprived. Oftentimes you forget about the care for yourself. You're more focused on your baby. So you really just want to get a lot of rest. You want to stay really hydrated, especially if you're breastfeeding. Just care for yourself.
What are some of the symptoms that we should look for? And I say we because if mom has a partner, maybe they can look for symptoms in the mom that just delivered?
Sure, yeah. So when you go home, you're going to want to look for signs and symptoms of too much bleeding. So if you're soaking more than a pad an hour, you want to be very conscious of that. You want to go to the hospital, call your doctor if you have a fever of over 100.4. If you're a breastfeeding mom, you're going to look for signs and symptoms of what we call mastitis. It's a infection in a clogged milk duct. Also, if you are having signs and symptoms of blurry vision, a headache that won't go away with medication, we're always concerned about postpartum preeclampsia, which is high blood pressure.
So when it comes to recovery, there are two types of birth. We've got C-section and vaginal birth. Yeah. What is the recovery mode for each? How long should that take with each type of delivery?
Right. Well, every patient is different, but generally speaking, a vaginal delivery with no complications, so no tears, no episiotomy, you're looking about 3 weeks. If you do have a little bit more damage, then you're going to be about 6 weeks out. For a C-section, it's usually going to be about 4 to 6 weeks.
And the doctor determines which is safest for mom and baby?
Correct. Generally speaking, they do about a 6-week recovery period for either or.
Any other tips or advice for mom postpartum?
My biggest advice would just be to give yourself some grace. Breastfeeding's hard. Having a new baby is hard. And it doesn't matter if it's your first baby, your fourth baby, your eighth baby, it's still hard. You're still relearning everything over again, and it's a new person that you're introducing yourself to.
Aw, usually they're so adorable. Cate, thank you. Really appreciate it. And for more tips on postpartum, go to our website, foxreno.com.